Okay, welcome to series 2 of Family Planning and Genetic Kidney Disease, where we're talking about options for extending your family. So, Carolyn, what options do families have to extend their families?
Yeah, good question. Look, there are actually many options available to you. And again, a genetic counsellor can go through all these with you, but let's go through them now. So one option is to actually, not do any testing at all. That's a perfectly valid option for many people. Some people don't want to know ahead of time if their current pregnancy or future children will be affected. So it kind of makes sense for them to just see how things go because it wouldn't change anything for them. So for these people, this option's right for them because they're prepared to take the chance. And for them, the family planning decision making, wouldn't change if they knew they had a baby that was affected, that was on the way. So therefore, no testing is a perfectly valid option for them. So that's number one. And then we've got, testing in pregnancy options, and there's a couple of these options. So you can test a pregnancy that's underway, and the first option would be testing it around sort of 12 weeks through a test called CVS, which stands for chorionic villus sampling. And this is where they take a sample from the placenta, which is sort of the sac around the baby, and or another test at around 16 weeks through a test called amniocentesis, which takes a sample from the fluid that's in the baby's sac. And both of these tests can provide you with really as close to 100% accurate answer regarding whether your baby is affected or not. Now, these tests actually are both what we call invasive tests. And whilst they don't actually, touch the baby as such and don't harm the baby through touching, they can tamper with the environment of the baby. And so we know there's actually a small risk of miscarriage that can be associated with having these tests. So the risk is low. It's about a 1% chance or 1 in 100 chance for having, the CVS at 12 weeks, and about a 0.5 or 1 in 200 chance for miscarriage associated with having an amniocentesis at around 16 weeks. Now, some people, wish to undertake one of these tests because they actually plan to stop the pregnancy if the baby is affected. But there are other reasons for doing these kinds of tests. Some people choose to have these tests to prepare for the possibility of having an affected baby. So there's not just one reason to have this kind of test. And, through having these tests, actually, you might be having it for looking to see if you've passed on your kidney condition. But actually, there are other additional genetic tests that can be added on when you're having these tests, such as testing for Down syndrome, for example. Now, considering to stop a pregnancy is, of course, not an easy decision. And so, really recommend discussion with a genetic counsellor to really understand more about what is actually involved when having these tests and when considering stopping a pregnancy. Now, the third option is actually using IVF technology and adding on genetic testing of the embryos. So you can use IVF to create embryos in the same way that couples or individuals might when they've got a history of infertility. And then you can actually do some genetic testing on the embryos through what's called pre-implantation genetic diagnosis. And this is where they take a couple of cells from the really early forming embryos and actually do the genetic test on those cells. Now, as with sort of standard IVF, there are, medical considerations, and particularly for the female, because this involves, hormones and injections. Now, the IVF with the genetic testing there are some costs associated with this. So there is some partial funding by the Australian government to cover some of these expenses, but there is still, for the most part, an out-of-pocket expense with this option, somewhere in the ballpark of around $2,000 to $3,000. But again, would recommend that you speak with a genetic counsellor and maybe with a fertility specialist to get more specific advice about those actual costs. Now, this almost sounds like a magic bullet, and it's not. There is no kind of guarantee of everything working perfectly with this kind of option. It does not guarantee a perfectly healthy baby at the end of it all. There are many steps involved, as is the case for routine IVF, okay? And so therefore there are many steps along the way where things may not work optimally, and that might reduce the overall success rate. So the current statistics tell us that there's about a 40% or so chance of actually, ending up with a baby at the end of the entire process from start to finish, because of these various steps where things may not work optimally. But people can have, several rounds if it hasn't worked the first time, and if they feel it's the right option for them, then they can keep going. So I guess in summary, as you can appreciate, there are really many physical, emotional, and financial factors to consider when contemplating the option of IVF with genetic testing. Now, another option is actually using egg or sperm donation. So using other people's eggs or sperm. So if one of you is, say, a carrier or actually affected by a confirmed, kidney genetic condition, then you can actually use egg or sperm that's donated to reduce the chances of passing the condition on to your children. Now, donor egg or donor sperm are not always easy to access. And so again, if you wish to explore this option further, then we would suggest that you discuss with a fertility doctor or an IVF provider. Okay. And then I should just mention, I guess, one final option, which may not be attractive to many people, but something that we should always mention to put all the cards on the table, is that for some people, they're not wanting to sort of pass down the condition. They're not wanting to sort of explore all these, medical type options. And for them, perhaps, adoption might be an option worth exploring. So again, just the final option to sort of put on the table.
So lots of choices, lots of deliberations. Whose choice really is it down to?
Yeah, absolutely. Good question. And look, we suggest you go and speak to a genetic counsellor or a fertility specialist or your kidney doctor. However, at the end of the day, the choice is really always up to you. The options are presented to you and it's up to you. There really is no right or wrong pathway or right or wrong decision. It's a very personal decision, and really nobody should tell you what to do. And so in general terms, we don't recommend people making any particular choice. People will often ask us, what do you recommend? What should I do? But rather we promote informed decision making, which means you're provided with all the information and are then encouraged to make the best decision for you, and we support you to make that decision, because at the end of the day, you need to live with the outcome of the decision, not the doctor or the genetic counsellor. So it's really always your choice.
So we talked about the genetic counsellor, fertility specialists.
Yeah.
Where should families go to help navigate these difficult decisions?
Yeah, so look, as we mentioned earlier, you can be asked to speak to a genetic counsellor, and there are genetic counsellors in many different hospital settings around the country, okay? And they can, as I said, provide you with the information and help you make that decision for you. Your kidney doctor can also help, because they'll know about your condition and the impact of your condition, so they may be able to help you make some decisions. And again, it might be in conjunction with a couple of people like your doctor and your genetic counsellor together. Some people perhaps value speaking with other people who've been through a similar situation, who are a similar experience. And so some people like to approach or contact, kidney advocacy groups who might be able to provide them with some support around that decision-making process, because they've got that lived experience as well, and may have made those kinds of decisions themselves in the past.
So in your experience helping families navigate these difficult decisions, what's your experience of the main concerns that other families express along this journey?
Yeah, look, it's a difficult journey, I think, when you're living with your own condition and then thinking about, the chance of passing it on. Some families are really quite unsure about whether they can actually manage having a child with a rare kidney condition, because they may be living with it themselves and may have had a difficult time with it, and they might feel it might be a burden, passing this on to their future children. Sometimes they express concern about living with uncertainty, and so that's kind of why they're contemplating having testing, because they feel they can't live with the uncertainty whether their future children will be affected and how that might affect their future. People often express sort of concern about what the future will look like, and what kinds of treatments might be available, and what kind of life their children might lead. And so there are lots of different concerns, and they're all valid. And again, that's why we say there is support there from a genetic counsellor, your kidney doctor, or advocacy group who can help sort of support you and address some of these concerns.
Great. Well, that draws this second series to an end. Join us for our third series about options for families who are currently pregnant and affected by genetic kidney disease.